I think back when I first started here in 2015, our hospital had some infection prevention issues, right? And so it was well publicized. And so our internal media folks would latch on to anything good that was happening with infection control, right? Because they wanted to publish that. And so they started doing internal stuff. Oh, we interviewed Chad and he's our infection control director. And they put me in front of like the hospital staff or whatever. And so they tried to start publicizing that. So then when the Ebola pandemic was happening, right? Well, we need local experts who can talk about this. And they said, well, Chad, your team knows a lot about this. Why don't you just talk to the news? And it was like, me? Like, okay, I mean, I guess, right? If you're the person in the room who knows it, and they ask, you want to answer that. So I started doing things about Ebola preparation and things like that with just local news. And then COVID happened, right? And then that just completely exploded the amount of media requests coming, to the community. And so why me versus someone else? Well, I think it's probably because our organization here in Jacksonville, we seek to be right the leading, experts on what we do. And we have a very low amount of sort of bureaucratic red tape when it comes to media things. And so at the time, our then CEO, Dr. Leon Haley, said, well, Chad's the expert. Why do they want to hear from me? Put Chad on the news, right? He's the guy. And that was it. And so we became the hospital that all the news agencies would go to first to ask to talk about COVID. Yes, we were the safety net, so we had a lot of COVID patients that were really sick, but we're the academic hospital of Jacksonville, and we wanted to put that expertise to work. So once I started doing it for one station, then the next station locally started calling, then the next one. And then somehow somebody from national news, picked up, probably because we're in Florida, and Florida was well publicized for a lot of things during the pandemic, a lot of it not good, but we did end up on national news. And because we kept saying yes to the media, more people started asking. And as I grew more comfortable in media interviews, then those requests started coming straight. Well, we want to talk to Chad because Chad, speaks in small sentences or easy to digest, or he doesn't look flustered on camera, right? And which I was initially. It was like, oh my God, like what? I don't want to be on the news. But with time, you keep doing something, you get better at it. And that, started happening. So after a dozen or so interviews, I sort of became the COVID person for Jacksonville. And then, after 25 or 50 interviews, then it became I'm the COVID person for Florida. And then it became national, where CNN wanted to talk. Or NBC News or BBC or wherever. And then this funny thing happens in media where like the local channel will pick you up, and then my mom in Orlando sees me on her news, and she's like, I didn't know you did something for Channel 2 News in Orlando. And I said, I didn't. And she's like, there you are. And so then you realize the news agencies in the state start sharing amongst each other, right? NBC talks to NBC there. And so then it just gets completely out of control. But I think I think the number one thing is, right, we wanted to educate. We wanted to be that confident source in a sea of misinformation that people can come to UF Health Jacksonville, look at me or whoever on camera and know that, hey, we're telling you the truth because we are one of you. We are a local, we live here, and we want the best for our community. And it just kind of proliferated from there.